The youth mental health crisis in our country has reached a breaking point. All this week, CBS News has been investigating the problem and highlighting solutions.
And tonight, we are looking in our own backyard. Investigative reporter Brian New with why a shortage in psychiatric beds has now forced parents to get help wherever they can.
For desperate parents with children in desperate need, help has become hard to find.
We've had many stories of families trying to get them in to see someone, but the wait time is months to get in to see a psychiatrist.
And that is why, in record numbers, they're showing up at emergency rooms. In the past 3 years, Cook Children's Emergency Department in Fort Worth has seen a 36% increase in children coming in with mental health complaints. Natalie Carpenter, the director of emergency services, says those struggling with suicidal thoughts are taken to one of the hospital's 5 safe rooms. Here, the outlets are covered, the furniture can't be moved, and the bed has restraint points. The average length of stay in these rooms is 8 hours, but for some, it's days. Children here are kept safe, but it's often not a place that can treat them.
It's not an acute thing that we can easily give them one dose of medication and let them go home. We try to do the best we can, but it's not that slam dunk answer that they really want.
Dr. Taylor Loudon says what these children need is to be at a mental health treatment center and to see a child psychiatrist. But there's a shortage of both. According to the American Academy of Child and Adolescent Psychiatry, for every 100,000 kids, there needs to be 47 child psychiatrists. But in the U.S., there are only 14 per 100,000. In Texas, it's 10 per 100,000. Here locally, Dallas and Tarrant counties would need to add 450 more psychiatrists, 4 times what they have, to meet the current need.
So yes, training more residents in psychiatry is essential, but even psychiatrists say that by itself is not enough. More prevention efforts are needed. And we found some here in North Texas are starting that at a very young age.
It starts from pre-K3 when our kiddos come in here. It's teaching them that stress is a part of life, but how do I cope with it?
For 30 years, the Memento School in Oak Cliff has taken proven mental health practices and incorporated them into their classrooms. Starting at the age of 3, they teach how the brain works. And all the way up to 5th grade, they give students research-based strategies on how to control emotions and impulses. Mental health is not a subject here. It's down every hallway, in every classroom, and it starts at the top. Here, the school's executive director is a licensed psychologist.
And it's not a technique you pick up off a shelf and say, I'm going to do this for 5 minutes. It's really taking the mental health practices that we've learned in psychology and incorporating them deep.
94% of students here are Hispanic, and almost all qualify for free or reduced lunch. Students who leave here go on to graduate high school at a higher rate than their peers, and nearly 90% go on to enroll in higher education. But success at this small private school is measured beyond academics.
We've been mastering this since we were like 3 years old, so.
Imano Vasquez and Emma Barrientos are 5th graders. This is their last year at Memento School. Next year, they'll go to a public school faced with all the stresses that come with middle school, along with tools to help cope with them.
And I've definitely learned to be able to ask for help now that I'm in a more calming place.
There are not enough mental health professionals. That is a fact. I don't know that there ever will be. If I could wave a wand, it would be a thing. But the other solution I think about is how do we take what a psychologist knows and mental health professionals and put it into the hands of anyone. The more we make that knowledge accessible, the better off our communities are going to be.
So the idea was floated years ago about opening up dozens of these schools all across the country. But school leaders felt like they could have an even bigger impact on more students by turning this into a lab school and taking what they've learned here and developing curriculum and trainings. Nicole, nearly every day here, there's a guest from another school district that is here learning and observing.
I was going to say they're kind of setting the precedent here for other schools to copy, and so that kind of brings me to the question of how does this get paid for? Where does the school get the money for this?
Yeah, so Nicole, this is a private school, but students don't pay any tuition. Nearly all of the funding comes from the Salesmanship Group of Dallas. This is the organization behind the AT&T Byron Nelson Golf Tournament, which happens to be the school's biggest fundraiser.
Brian New uncovering some very important information in our backyard. Thank you so much tonight.